Hello everyone. Good evening. Namaskar. I am Purnima from Fertility Dost. And today with you on this session, we are going to discuss a very important topic, that is fertility and pregnancy in COVID times. बहुत सारे सवाल में हमारे मन में आते हैं, क्या करें? And again, since for the past 1 month, the situation is getting bad and bad. Last year also, we heard many pregnancies, many deliveries, but again, ऐसा क्यों कि celebrities ही pregnant हो रहे हैं? Why not we? Why not we as a common man? Why not we hearing our pregnancy reports positive? Why? Why there's some doubt in our mind? कैसे होगा? अगर मैं pregnant हो गई तो hospital visits कैसे possible हैं? बार बार एक हॉस्पिटल में जाना, स्टाफ से मिलना कितना ठीक रहेगा? बहुत सारे सवाल हमारे मन में. एंड अगेन, इफ यू आर स्टेइंग इन अ जॉइंट फैमिली एंड इफ गॉड फॉरबिड one of the member tested COVID positive, then what about me? I am pregnant. Should I take precautionary medicines? वो जो कहते हैं ना कि जिंक और विटामिन सी खाइए ऑन रेगुलर बेसिस, इज इट सेफ फॉर मी to have those medications? What should I do? If I am in my early pregnancy, so can I take steams on regular basis? Can I do gargles? Or these gargles put pressure on my womb? I should avoid it. Should I maintain relationship with my husband who is regularly going to his office? I want natural conception. I want to take this opportunity with full hands. But what to do if, after trying for natural conception during my fertile days, my husband tested COVID positive? What should I do? Should I go for my COVID testing? Should I avoid everything? Many issues, many doubts, बहुत कुछ है. But हाँ, जितना हम सर्च करते हैं उतने डाउट्स बढ़ते चले जाते हैं. We have many good news from our members. We have many happy deliveries, many happy pregnancy news. But again, कुछ चीजें ऐसी हैं जो हमें दुखी कर जाती हैं. Last year also we lost one of our member. After 10 years of marriage, she gave birth to a beautiful baby boy. But we lost her. She tested COVID positive after giving birth to her boy. What about her? Full 10 years. She waited for this beautiful moment to hold her baby in her hands. But nahi ho paya. Even last month also, we lost one of our community members. She was 5 months pregnant. She was COVID positive. But again, she ignored her symptoms because she doesn't want to go for testing. ऐसे में क्या करें और क्या नहीं करें? बहुत सारी चीजें हैं. वैक्सीन लें ना लें. And up to from 1st May, the government is saying that yes, everyone 18 plus can have vaccine. Is vaccination is safe? Is it possible for me to hold my sweet little child in my hands? Is it possible for me to hug that bundle of joy? कोविड है नहीं है, बहुत सारी चीजें हैं. हम खुद परेशान हो जाते हैं कई बार इसके बारे में सोचते हुए. तभी हमने सोचा कि आज हम आपके इन सब सवालों के जवाब देंगे. अभी right now at this moment we have live session at Facebook with Dr. Priya, and where we are sorry, going to discuss about fertility and pregnancy in COVID times. And after this session, At 6 we have Insta Live with Dr. Uma, जो कि आपको ये बताएंगी कि हाँ, डर तो है, बट कैसे इस डर को भगाएं, कैसे इस डर को जीत के हम आगे बढ़े इस सिचुएशन में. सिचुएशन बुरी है, आई नो. द टाइम्स आर रियली बैड, बट यस, वी हैव टू डील इट. So to answer such questions, we have Dr. Priya Kannan with us. Hello, ma'am. Good evening, and
Hello,
welcome to our
good
forum.
evening. Thank you so much for the invite. It will be a pleasure interacting with all of you.
Right. So, Dr. Priya is a director of Garbba Rakshambigai Fertility Center, Chennai. It's a bit difficult for me to pronounce, but I think ठीक बोला मैंने.
You did a
And
great job. Mhm.
and before going live, we were discussing about this name, this particular name. Maybe viewers from South India must have know this fact, that this name is about a goddess, the goddess which provide you with blessings, with help you to give birth of your child. And Dr. Priya just mentioned that we relate this goddess to in vitro fertilization also.
Yes.
So we'll discuss about this story in later half. And right now, we would like to start the session. And before starting, I really like to thank Shield Healthcare for being our fertility awareness partner for this session. They are helping us and arranging many renowned doctors to have chat with us. Live sessions continuously are helping our viewers. And with Dr. Priya, we are going to talk about fertility and pregnancy. So, ma'am, let's start with this. And the first thing, we are getting comments. First of all, I just want to hear from you. Is it really safe to try natural conception or any fertility treatments?
During the COVID times.
Right.
Okay. At the outset, I wish to offer my condolences for the two members that you've lost. I'm very sad to hear that, basically, because as you said, after 10 years, when a mother dies because after giving birth, it's can't even imagine how the family would be, how would it be. I'm really sorry to hear that. But another mother also we've lost. I think loss of a mother is huge for in terms of not just the family, for the entire country and the society. We don't want to lose any mothers, and I'm sure you all know all the work we do to save every mother that is who get pregnant. Yes, and the first and foremost, as you have said, one shouldn't any day not accept the symptoms and go to the hospital. The first thing is, whenever you feel even the iota of doubt, please go. For example, in our house, we would have tested at least 7 times in the past 1 year. Like, one after other, will be having a doubt, and we'll be testing ourselves. We've even tested our children for the same. So I think it's nothing wrong in getting tested. Let's get tested. And coming back to your query, it has been quite a fantastic or a revelationary 1 year for us in the fertility care. We've had so many of our patients who have been trying for a pregnancy for years using technology and everything, have had spontaneous conceptions. And it is quite okay, not just our patients, we've had quite a number of fertility rate during this 1 year, primarily, basically, probably because people have been indoors, husband and wife have been indoors together, which is not being possible nowadays because of the work schedule of people. So I think people have been together, and the spontaneous consumption rates in the past 1 year has been very good, been non-fertility and infertility patients as well. It is quite okay to get pregnant. We don't advise against pregnancy at all in COVID times. Yes, we actually encourage and say, because you've had the opportunity to close to the partner, and please go ahead and try. That's exactly would be our words.
Right.
And to reassure you on certain things, I would like to present a statistic which was just presented yesterday, which was by our
Okay.
FOXI, which is a Federation of Obstetric and Gynec Society of India, who have had about 2,700 cases, who studied about 2,700 cases until the end of August last year from both West, North, and South. They had a COVID registry until August end, which is where, unfortunately, out of about 1,000 positive mothers, 10 mothers died, which is very unfortunate, but then which is not very high number. The pooled average is about 1,000 per lakh. That's exactly is it, but it is quite high compared to the regular maternal mortality rate. But then this is the
Right.
statistics, and very few, like 7.1% required critical care. 757 out of the 989 gave birth, of which 60% was cesareans and 20% was about preterm delivery.
Okay.
22 stillbirth happened out of the 752 deliveries, and 13 infants, which is about 2%, had about vertical transmission, which means they had the COVID from their mothers. I think this was the data of the about the 1,000 cases we've had, which sounds reassuring because only about 7% required critical care, which is quite a small number. Even otherwise, from our personal data for the past 1 year as well, we've had mothers who tested positive during pregnancy and right after delivery as well. And by God's grace, they all have done well. The babies were negative, but yes, it did skip pregnancy. Fortunately, COVID has been very kind on pregnant women.
So I think this is a positive thing and positive note to start this session,
Absolutely.
because things are really getting worse day by day. So, Dr. Priya, one foremost query is that what about this vaccination scene? If, as you say, that from 1st May, the vaccination is going to be open for all 18 plus. So, is it safe to go? And what about the second dose? There's gap between that, and should we get pregnant in between two vaccination doses and between pregnancy is possible, or we should cover the distance from first to second and then pregnancy?
That's an excellent question, which is evading even us. We don't know what to do it. We don't know what is the right thing to tell because not much of publications have come around in this particular area. But we do know that yes, from May 1st, everybody can get vaccinated. Please go get yourself vaccinated. I would definitely recommend that because whoever the virulence may be high, the infectivity rate is quite high now. More people are getting infected. But the positive note that we have from vaccinated people getting COVID is that the severity is so much lower, which means they don't have the necessity to go for oxygen, high flow oxygen. They don't have the necessity to go for critical care, which is the key. If it reduces severity, what more do we need from the vaccine? This vaccine is not designed like the other vaccines, where it absolutely prevents the disease. Here, it reduces the severity, and that's exactly what we want from this particular vaccine. We might get affected. I would be probably having the fever, but I may not require the high flow oxygen or the critical care. And that is the advantage of having the vaccine. And in terms of pregnancy, vaccination during pregnancy is contraindicated. Pregnancy and vaccination when you're nursing is also not advised. Basically, not because it will affect the pregnancy or it will affect the baby, but it is just that we don't have studies to show, enough studies have not been published to give us the reassurance that it does not affect. There has been a recent study which said that they had vaccinated, it is quite safe to vaccinate mothers as well. but then it has not come around and our government has not given the guidelines. Even if it is okay in USA, unless our government gives the guideline, we cannot go ahead and advise patients. So in that way, right now, we don't advise uh, pregnant women or nursing mothers to get vaccinated. However, having said that, people who in between vaccination, what do we do? See, the ideal way would be you get your second dose and after a month you get pregnant. But then it becomes quite cruel to say to fertility patients that, for the next 3 months, you're not supposed to get pregnant. Um, I mean, we really do not know because there have been so many patients whom we have not detected COVID, but they've gotten pregnant. And I mean, we didn't detect, meaning they didn't have the symptoms, so we didn't test. They could have been positive for all asymptomatic positives. So they all have got pregnant as well, which have not seemed to affect the baby. Even the babies which had vertical transmission did not seem to have any adverse effects on the child. So we are not really saying in between for non-fertility, we are not saying you should abstain from having intercourse. We are saying we're not even giving that advice. The government is not even asking us to give that advice. We're just asking them to go ahead, but then we are not vaccinating. We have not given the go ahead by the government to vaccinate pregnant mothers and mothers who are nursing children.
Nursing children. Okay. One question: if I am pregnant and one of my family members tested positive, so what should I do? Should I take that particular zinc and vitamin C, or should I go for test first and then take medications? What to do then?
Okay. The first thing is please get yourself tested. That's the first key. If somebody is pregnant and then a family member, a close family member who lives in the same house has tested positive, please get yourself tested. You could be asymptomatic or symptomatically positive. Just get tested. It is as simple as that. If you happen to be positive, then if if you're completely asymptomatic, you can isolate yourself at home and just be there.
Hmm.
If you're tested negative, still isolate yourself and be in the house as if like consider that everybody else is positive and only you're negative. So that just it is just to protect yourself and the baby. So that way, if you're there for about 2 weeks and everybody else becomes negative, even the person who is positive, tested positive in the house, has been prescribed only home quarantine. That way, if you separate yourself, then you're safeguarding yourself and the child. So don't worry about that. The first thing is please get yourself tested. That way, there is no ambiguity in the treatment or the management that we need to take. You can take zinc and vitamin C. There is no objection to that. It is quite safe. We actually prescribe that to a lot of mothers who had, for example, somebody has got recurrent pregnancy loss. That is, they've lost a baby's pregnancy in the first 3 months. We do prescribe, give them therapeutic dose of vitamin C and vitamin zinc and vitamin E during the first 3 months of their pregnancy. So it's very safe to take. No need to worry about that.
Okay. So first thing is go for your test, and yes, these medications you can take. And ma'am, one query is that if I am tested positive as a mother of newborn baby, then how to handle the kid? Is it safe to nurse the kid or totally avoid the mother and kid connection?
Okay, the first thing that we have seen what the protocol that we have been following in the COVID centers here, and what this is what happened to our postnatal mothers as well. The moment the mother is tested positive, the child is taken away because the child is considered negative, and then the child is also tested. If the child is negative, then the child, mother and child are completely separated. We don't. There is no breastfeeding. Yes, you can breastfeed if you wear the PPE and all that stuff, and then you can do, but then only if the mother is asymptomatic. If the mother is symptomatic, then it's not, it's not recommended. But then if the mother is completely asymptomatic, she can wear the PPE and all that stuff and then still nurse the baby. But then, yeah, it depends on the baby has to go into the COVID ward and come out as well. It's not
Right.
that that also puts a little bit of risk for the child. So we had in our mothers, they were quite all right. In 3 days to 5 days, they were discharged from the COVID hospital, and hence they went home and started nursing the baby after 5 days. But then, even then, they were wearing the mask, and then only they were feeding the baby.
So you can do the needful, but again, precautions. You
Yes,
have to take those precautions. Uh,
yes.
I just want to tell my viewers that this session is related to fertility and pregnancy in COVID times. But yes, if you have any other queries related to your IVF treatments or natural conception, you can post it. We'll surely going to take that. And Dr. Priya is in Chennai, and if you want to meet her or any kind of teleconsultation you want, please let us know about that also. You can message us on the given number. This is our official number. We'll arrange for everything. And if you are feeling somewhat uh, uneasy, feel is there to ask your queries on this social media platform, you can post anonymously also. So, ma'am, the ET, embryo transfer, again, this is there for us. After how many months of taking vaccine can a person go for embryo transfer?
1 month. So
Okay,
after
great.
1 month after the vaccine, we say you can go for embryo transfer. It is only after a month that we start the treatment as well, and it is only after a month that we say you go for IVF as well. We start the stimulation after a month. The embryo transfer is also after a month. If somebody turns out to be positive as well, we don't recommend that they come back after 14 days and start their resume their treatment. We ask them to come after a month as well. So we give them
Okay.
that one whole month of uh, everything, whatever needs to be settled down, because this is such a new disease that we don't know much. Whatever we know is only what we have learned in the past 1 year. And whatever a
Right.
lot that we have known is from our experience with our patients as well. So before we used to ask them to abstain from anything for treatment for 2 months. Now I said, okay, 1 month is fine. So you come after 1 month. But as such, you can do after, if you've been positive, 14 days, it's fine. But then 1 month, because then you can be very sure that you're not infective at all. So that gives the reassurance to them and their family and everything. But after vaccine, after the second dose of the vaccine, you can have your embryo transfer after a month.
So you have to wait for another month or so
Yes,
before
yes.
going for your embryo transfer. But I think the this wait is good, is the
This
betterment.
week is good, and I think it's you can take your time to chill and reduce some weight, get into real healthy habits, and make your body much better. Implantation rates goes up, and we can use that 1 month in a very productive way. So yes, that's
Right.
how I tell people, like, don't think it. You're just sitting at home. You're having nutritious food, and you can, if you're not having dyspnea, that is, you're not having breathlessness, have continue your 15 minutes walking, drink lots of water, and lose some weight, and it improves your implantation rate. So you'll be happy. Everything goes towards that happy outcome of having a baby.
Right. So, as just Dr. Priya mentioned, that please utilize your time. And for this utilization of time, you can contact us, as we have many in-house experts who are there to help you with your nutritious food, various different recipes. I would say healthy recipes, fertility, yoga, and counseling sessions also. And plus, you have our live sessions to clear your doubts. So, ma'am, what if I catch this disease during the 15 days wait period?
Okay.
Then what to do?
Nothing. You just wait, and then you test positive, and then you just wait, and then we send somebody to do the blood test, and we take the blood and we do it. And then, anyways, in the first 1 week after we test and we send pack of medicines as well to continue. Nothing, just stay put. If at all you're positive and you're asymptomatic, home quarantine is enough. If you are symptomatic, you might have to go to the hospital. And at that point of time, if any medication has to be given which can affect pregnancy, unfortunately, we cannot say no to the intensivist. We say, go ahead. The mother is more important. We can try for pregnancy again. So any day the mother comes is the most important person. So at that point of time, if there is anything that the mother becomes critical and some medications has to be used which can hamper pregnancy or which can affect, we really cannot say no, we had embryo transfer. The mother becomes more important. So we just tell them, please go ahead with the medications. We can do the embryo transfer again or do something later on. But all that can happen only if the mother is there. So the mother becomes most important. But then that's a
Right.
very sad thing at that point of time, but we can't help it. We have to take all precautions to keep the mother safe.
You suggested zinc can be easily taken and few vitamins also. But what about antibiotics, which we usually take during COVID infection and all that? Is it safe to have those medicines?
Generally, as a prevention, what we to reduce severity as well, what we've been giving is vitamin C, zinc, and D3, vitamin D3 as well. 60,000 international units once a week for 8 weeks, and then at least 60,000 units once a day, once a week, once a month for at least some time. Suppose they are pregnant, they give azithromycin, and ivermectin, and even some of the even remdesivir, which is given, it's safe in pregnancy because remdesivir, these are all antivirals which have been used in women who have had HIV and pregnancy. So these have already been used extensively in HIV positive mothers. So it's quite fine to use. No
Right.
issues.
No issue. Viewers, please, if you, we don't want you to be infected with this disease. Obviously, we never want. But in case you have those symptoms, you tested positive, then don't worry. In case your embryo transfer is few days back and now you think that symptoms are showing in your body, so don't panic. Just take your medicines as Dr. Priya just said. These are safe medicines. And I think positive mindset also helps. So अच्छा सोचेंगे तो अच्छा होगा. कोई बात नहीं, हम वो 15 days का टाइम पीरियड वेट करके इसी तरह निकाल लेंगे. बट प्लीज डोंट मिस ऑन दिस पर्टिकुलर पॉइंट, दैट इज योर मेडिकेशन. बिकॉज माँ है तो सब कुछ है, एंड आवर प्रायोरिटी इज यू. बिकॉज इतनी सारी चीजें हैं डॉक्टर प्रिया, वी फील के व्हाट टू डू, whether we should suggest them this thing, that thing. And when you are suggesting some proper pointers to other person, उसके सोचने का तरीका ही बहुत डिफरेंट हो जाता है. We are trying to help, but yes, how you are going to take those statements, that is the main issue.
I
I
understand.
think
I mean,
we,
the most important thing, the first thing I say, I sit with my patients and then I must confess to you, I'll sort of little bit scare them. Like, wear your mask properly, wash your hands, don't go out anywhere unnecessarily, and clean practices. That is the first key that I sit and counsel my patients. As you say, I little bit scare them, like, that thing, that little bit scare them. What happens if you get it after post embryo transfer? So remember that and just please take care of yourself. And that helps. All our patients are extremely careful because, the hospital environment itself is kept like that. I ensure that there is discipline in terms of the moment somebody walks in, we give them soap and water to wash their hand. And then the moment everybody has to wear a mask, and if preferable, I tell them. And one key thing I tell all my patients is possible, please wear a surgical mask, not a cloth mask, because the surgical mask gives them more protection. And hence, I tell them, please buy a surgical mask. Whenever you're going out, wear that. If not, a cloth mask is slightly less protective. So just ask, do that. And I tell them, please, when they come in, there's soap and water and then masking. And there is, there is, everything is like arranged, like, there is such a vast distance between them and me, from them and the receptionist. And they're made to sit so spaced out, and their appointments are spaced out, so everything we've taken care. So I think that when we keep on inculcating in our patients, they continue that in the at home as well, and they are very conscious about how like, about all the major things. The most important vaccine against COVID, which is not going out unnecessarily, wearing a proper mask, and sanitization. I think that's the most important vaccine that we have. Let's use that vaccine first. So when they do that, and it's hugely advantageous to our patients.
Right. And I think we should add to this that wear double mask. That is more important nowadays.
Yeah, true. If you can
Single
double
is
mask, I tell them wear a cloth mask and then a surgical mask over
then
it. So that, when there is some saliva and everything comes on the cloth mask, then that remains with you. It doesn't go onto the surgical mask, so that it's cleaner. It cleans the air much more when it comes from outside. So yes, I sit and talk to them for 5 minutes every time they come. I stress on this and tell them. So I think that's the key. That is remembering that every time we go out, remembering, trying to put it into action in the entire family. That gives the protection to the entire family.
this is more important nowadays. So, ma'am, like we have this embryo transfer query again. And what about the person who has already delayed treatment and age factor? Wants to go for ET early and not delayed. So, can the vaccine be taken or again delayed? Kindly advise. Thank you.
Yes, this is a dilemma. The last year, after like 4 or 5 months of, when they said for 2 3 months, they said close down all the electives, no electives, so no IVF, nothing was happening. So many patients of ours, their AMH is so low that they were waiting just in the April to go for IVF. So all their 3 months of postponement, they got so stressed, sort of they went into depression. We had online consultation. They would come every week. They would be just that they'll just call me up just for the reassurance. Madam, just tell me if it'll be all right. And that they were so stressed about that whole thing. But then after 3 months, 4 months, like from, let's say, I think August, we just couldn't wait. And we wanted to start in June, but then there was some consumable issues. So we started around July. From then on, the first set of people that we selected and started doing IVF were the patients who had poor ovarian reserve. So we gave
Right.
them the preference, and then we said we will do for you first. That is the first. Those are the people who we wish to do, and we did. And but if you already had the eggs and the embryos taken, and your embryos are already in cryopreservation, delaying your embryo transfer by a month, it's okay. If you are yet to go for an egg pickup, then time matters. But if you already have enough number of embryos in frozen and they're waiting for you, then delaying by a month does not matter. Even I had one come back after 8 months to have her embryo transfer because she couldn't travel back from her native where she had gone for COVID. But then she came back after 8 months and had it, no issues. I mean, this is like the only two embryos, 2 eggs and 2 embryos. She gave me 2 eggs, so 2 embryos were frozen for her. So she just came back after 8 months to have it. That is all right. But then if you're yet to have your egg pickup, time matters a lot. If you're having vaccination also, for any reason, if you're delaying, then not that you have to delay, it is recommended to go after a month of the second, which means you will be losing 6 weeks first dose, and then second dose around 6th week, and then a month later, so 2.5 months later, you'll be having your embryo transfer. Let us say 3 months. If it's okay. If you've already had your egg pickup and your embryos are waiting, doesn't matter. But if you're yet to go for your egg pickup, have your egg pickups and then start your vaccination. I mean, that's a way to
Right.
work around this solution, this problem
Bilkul.
that.
So I think this is very important point. If you are on the lower side of AMH and you are planning for your egg pickup, then please do the procedure. Go for your egg retrievals. After that, go for vaccination. Wait for 2 months and then go for your embryo transfer, because we don't want you to have any kind of infection during your embryo transfer procedure. It is always safe. So I think this is the main concerning points for viewers, that what to do, how to do. 50% of work please complete before vaccination, and yes, 50% of work after vaccination.
Yes, true.
दिस इज इम्पोर्टेंट. एंड अगर आपके आसपास कुछ ऐसे लोग हैं जिनको समझ नहीं आ रहा वैक्सीनेशन कब लेना है, ट्रीटमेंट कैसे प्रोसीड करना है, तो आप प्लीज उनसे शेयर कीजिए ये सब. आप ये वाला सेशन हमारे फेसबुक पर सेव है, आप इसका लिंक शेयर कर सकते हैं, उनको बोलिए इसको सुने, ध्यान से समझे, बिकॉज कीवर्ड्स आर दीज पॉइंटर्स ओनली. You can easily go for egg pickup, then go for vaccination, and then embryo transfer.
That's right.
So I'll take another query over here. This is from our group member. I'm 30 years. 2 years back, I had ovarian endometriotic cyst with uterine fibroids. Surgery with myectomy. Now my AMH is 0.288. I did 3 IVF cycle with donor eggs of day 5 embryo, but it failed. My husband DNA fragmentation is minus 10.75. What went wrong in the cycle and what should I do next to make it successful? My lining was also 10 mm.
Okay. You had a donor egg and then a blastocyst as well. What were the blastocysts told to be of good quality, or how was it? If you can give me some idea on that, that will be very good. And you had a very good endometrium as well. In this case, since you had already 3 IVF cycles, that is 3 IVF cycles mean through 3 frozen embryo transfers probably with the donor egg. I would suggest that if you've had this and still you've not had pregnancy even after 3 blastocyst transfers, I would recommend to go for endometrial receptivity testing to see whether the endometrium is receptive on the day 5 that you had very good embryos. If the embryos are good, you come under the category of the, as per definition, the implantation failure. So in that case, please do check if your endometrium is receptive to the embryos after 5 days of progesterone. That is number 1. Number 2, if they are endometrium receptive and still we are not able to achieve pregnancy, I would suggest go and do a genetic testing of the embryos, PGTA, to know if the embryos are chromosomally normal or abnormal. So, I mean, if the chromosomal embryos are not normal, then that is an issue as well. If the endometrium is not receptive, that also is an issue. So after 3 attempts, I would definitely recommend endometrial receptivity testing, plus combined with the PGTA, that is, or the previous way that we used to call it PGS. Please go ahead and I would recommend that you do it.
So a few tests for the soil and few tests for the seeds. Both the factors are important. So yes. Okay, this is very important. What if anyone gets pregnant naturally after the first dose and before the second dose of vaccine?
Okay. First of all, I would congratulate the person for that. That's I mean, anybody who gets pregnant, we're very happy. So that's one. So you defer the second vaccine. Don't worry about it. Don't worry that you've had vaccine and now you're pregnant. You don't have to go ahead and terminate the pregnancy. Please continue with the pregnancy. Just don't have the second vaccine. You can restart the vaccine schedule after your pregnancy, after your delivery, after finishing completing nursing of mother, nursing the baby. You can restart your vaccine schedule. You don't have to go ahead and do it now. Maybe in meanwhile, we could have the regulation stating that, the vaccine is safe for even pregnant mothers. Please go ahead and give it. Nowadays, to give flu vaccine for all mothers when they are about 28 weeks, it's mandatory. So, I mean,
Right.
not by the, yeah, even the government, they suggest. So, in that case, when we are giving flu vaccine, this also is a flu, different kind of flu, but then it's also is a flu. It could be incorporated in the vaccine schedule for mothers as well. We just have to
So,
wait for some data to come out.
right. Enjoy your pregnancy and
Yes.
yes, because we are hearing good news from many celebrities. So it's your time to be in that same boat of celebrity. And all the best for your coming months, for coming weeks, and happy delivery to you. Okay, someone is suggesting for a session on depression during infertility treatment, right? We'll definitely going to add this topic in coming live sessions. So this is the one thing that natural pregnancy and vaccine doses and all that. And what if I am trying to conceive and if I maintain relationship with my husband during my fertile days and 2 to 3 days after that my husband tested positive, then what should I do?
Okay. So, anybody, irrespective of whether we're trying to get pregnant or not trying to get pregnant, anybody who in close contact has become COVID positive, we must test ourselves as well. That's the first thing. So we test ourselves, and then when they are positive, we know that the very next day, please go and test yourself, and then we will take it as per whatever is the result, and whether one person, the person is symptomatic or asymptomatic. Doesn't matter. If at all you happen to be pregnant at the end of that month, don't worry. Just go ahead with the pregnancy. It's fine. It doesn't seem to have any adverse effects or, as we say, congenital anomalies in the baby. So go ahead. Nothing happens. I mean, nothing so far has been. Publications have come out saying that it happens. There are some anomalies associated with women who've been tested positive for COVID. There is no record whatsoever. We even had one publication like around last year, which said that 16% of the males who tested positive for COVID, there were 16% did have COVID virus in their semen sample. But then there was no, maybe there was no follow up. There was no reports after that which said that yes, even if it is there, it probably does not affect the anything, does not cause anomaly or abnormality or anything the baby. We don't have reports as of now. Till date, we don't have any reports like that. Even the Foxy report has not said anything. It said there is vertical transmission, but it does not mention anything about increase in anomaly. The baby had so and so issues or nothing. They just had some amount of 2%, 2.9%, let's say 3% vertical transmission. That's it. It did not affect the baby. So let's not worry about it.
Right. And I think during our conversation, we just forget about the male factor. What about the males? What about their vaccination dose? Because obviously their
Uh,
health are also important. So
Absolutely,
what you
absolutely.
suggest?
So right now, most of our patients, some they're not vaccinated because they're less than 45. So the moment, but I did have some patients who are from the army, some who are the police personnel who had themselves vaccinated. So it has been like a month after vaccination. So we did they were from the army, so they had only that 1 month window period or 3 weeks to have the procedure done. So we went ahead and had it. So did the IVF and the embryo transfer as well. And for a police personnel also, they had already vaccinated. So a month after, we went ahead and had the procedure, a month after the second vaccination.
Second.
However, if they are vaccinated or in the middle of vaccination and you happen to have a natural conception, as we have told before, there is no need to panic. Please reassure yourself that it is quite fine. Nothing has come untoward as of now about it. Only for procedures, when we are going in for a technology, we adhere to 1 month after the second vaccination. But then, if there's a spontaneous conception, please don't panic. Please reassure yourself that everything should be fine. Pray,
Right. So
pray,
both,
and pray that everything should be fine.
bilkul, both the partners are important. It's just not that we are focusing on eggs. We are focusing on other factors also. So this is very interesting. And bed rest, 15 days rest. What you suggest?
Okay,
After embryo transfer, 15 days leisurely bed rest, or just carry on with your daily routine?
I think I have a feeling, and that's what my patients have also told me. When I ask them to be bedridden, I think they go depressed. So that's, to be on the bed 24/7, I think it's quite depressing. See, I was trained in Australia where 20 minutes after the embryo transfer, we asked the woman to get down, and I was in Sydney IVF, which was next to the Sydney Harbour. They have to either take the car from the basement and drive back home, or they have to walk like 5-10 minutes and go to the railway station or the bus stop. So that's exactly we did, which was like 20 years ago. I mean, what I'm saying is 20 years ago. So even now, all my patients, what I almost say is I make them lie down for 15, 20 minutes or half an hour. And then I tell them, you please go home. But then our road and Sydney road, it's two sides of the same coin. So let us say it's not the same. But then, so what I advise my patient is, I tell them that there is no need to be bedridden at all. They
Right.
continue to, all the doctors who had treatment with me, I tell them, please go back to work because they can take care of themselves. So I tell them, if you put the doctors at home, it's problem for everyone else at home. So they'll be nagging everybody at home. So I tell them, please go to work. They go back to their OP, their ward duties, their surgeries, everything. For others, I tell them you can be at home, you can cook, you can read books, watch TV, cut vegetables, you can go about your daily routine. You don't have to, but when you tell them, then they start exerting themselves. So I also make it a point to tell them that please don't exert yourself too much. That I'm going to, clean the entire house only in these 15 days because I'm going to be on rest. Please don't do that. But then you can go about your daily routine. You can even have please walk around the house. You don't have to be bedridden. That is something I specifically tell my patients because it it puts patient at such a bad frame of mind that they get into depression. B, there has been no evidence whatsoever which can direct or tell us that being bedridden will improve the pregnancy rates in women. It just, there's no evidence whatsoever for that. So, but that 15-20 minutes of rest after embryo transfer or after IUI, in both situations, it will improve pregnancy rates. But there is no evidence to show that after embryo transfer, if you are bedridden for 15 days, your pregnancy rates are higher. So, and I have known patients who refuse to go for another cycle, who come from another center or so, there where they were asked to be bedridden. These women have that fear. You're going to be asked to be bedridden. I don't want to go through any cycle. So I tell them, no, 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 you please go to work. And whoever has the option of working from home, even before COVID, I tell them, the IT people, I tell them, I ask them, do you have the option of working from home? If they say yes, I tell them, please continue working. Please, if you have to work 12 hours a day also, please continue to work. There's no need to just stop working. It's okay. It doesn't help in any way.
And if you really want to do something interesting, then after your IUI or embryo transfer, you can enroll in our meditation and breathing exercises session that calm your nerves, that calm your brain, and that something positive enters your body. Just meditate, just
So,
make that connection. It will help.
yeah, you can
So
also
we,
develop a hobby in those 15 days.
bilkul, right. Extra time to do some extra work.
Yes.
So we'll take this one. I'm going for IVF treatment this month. Insert process waiting month. My doctor said endometriotic line 6.8 mm, very thin. This month also cancel. How to increase the endometrial lining?
Okay, for embryo transfer, what we, the cutoff which is given to us is like what we think is about 7 millimeters is the minimum, 8 is good, a maximum of 12 millimeters. So if something is 6.8, it's very close to 7. We would see if that is what we always compare your endometrium with the endometrium that you've given during the previous cycles of either doing IVF when you're doing the egg pickup or previous cycles. If your endometrium can come only up to 6 mm, then we would say, okay, Mrs. So and so, her endometrium comes only up to 6 mm. So we'll go ahead with the embryo transfer. But if we had demonstrated better endometrial lining thickness and the way it looks, the morphology in your previous cycles, we want to wait for another cycle. We cancel and go for another cycle because the endometrial pattern and thickness, when it is good, the pregnancy rates are quite much higher or much higher than when the endometrium is thinner. So for
Thin.
6.8, you just have to wait a little bit. Maybe the next cycle might be much better for you. They will give you lightly more medications. You can also have sildenafil, that is vaginal sildenafil tablets also can be given. But one thing that that I have observed is that when the patient is extremely stressed, the endometrium pattern, it becomes slightly thin. That you
Right.
would please relax yourself and just let go. Let go, saying that if I'm going to be stressed, then it affects adversely on all systems of your body, from the egg quality, the endometrium thickness, the endometrium quality, everything is affected. Just as Mrs. Purnima was saying, relax, go for some meditation, and let go. There is nothing much that if you are getting stressed, it puts you in a worse situation. So try to come out of it and make yourself more cheerful and more happier. That way, it on this side, it does improve. That is on the holistic side, but then on the medical side, you may have a better endometrium next cycle. And
Next
there are
cycle.
armamentarium in our medications like sildenafil, some probiotics, everything that we can try and improve your endometrium. So don't worry about it. You will be fine next cycle.
Right. As Dr. Priya said, it may be the possibility that you are stressed out. So I think now the viewers, it's time to shift about our Insta Live session with very known psychologist, Dr. Roma Kumar, and she'll going to talk about this pandemic situations, stressful issues, your family problems, and yes, if you are into family way and COVID strikes you, your family, then what to do? And again, thank you, Dr. Priya. Thank you for this. We started with COVID preparation. I think this whole word has something attached to it. COVID and that picture of virus with spikes strikes your mind. So, as you say, I
Scary.
don't, right. I don't want to take the name again and again, COVID, COVID. So please relax. Those spikes are not meant for you. Please stay safe. We can say so. And if by chance any symptoms, any other things are there, please don't hesitate. Consult your doctor. Go for meditation, medications. It will going to help you. And if you are into your fertility cycle, then please consult your doctor. आपका डॉक्टर आपके साथ हमेशा है. अगर आप पूछेंगे नहीं तो वो आपको हेल्प कैसे करेंगे? Don't hesitate. And again, Dr. Priya is in Chennai. if you want to contact her, you want to visit her, कुछ भी बातें जो आज रह गई हैं और आप दोबारा करना चाहते हैं, please let us know. And thank you so much, Dr. Priya. It was really nice talking to you. I don't want to see that virus with spikes again, but yes, our conversation helped many people. बहुत बहुत सारे myths थे वैक्सीनेशन को लेके, और अब जब से ये शुरू हुआ, फर्स्ट डोज, सेकेंड डोज, एंड यस, फर्स्ट मे इज ऑल्सो कमिंग. So we cleared those doubts, and thank you for such simple explanation of things. आपने हमें डराया नहीं, आपने हमें गलत बातें नहीं बताई, एक सिंपल सीधे तरीके से आपने हमें समझाया. And for this, thanks from our community, from our platform, everyone. Thank you, ma'am. Thank you so much for joining us today.
Thank you so much for the invite. It was a pleasure interacting with everyone. It was very nice, and I'm happy that I could give the message, because there are lots of confusions about the vaccination. There are lots of myth and wrong information about the vaccination. I'm very happy that I had this opportunity to address all of you. Thank you so much, and
Thank
lovely
you.
moderation of the session as well. I must say thank you so much for the lovely moderation.
Thank you, ma'am. Thank you.